Good.
Walk around at a 90-degree angle like every other one.
Yes, definitely. Good.
Yes, the posture part of it is what piqued my interest as well.
Okay, good.
And I also just got diagnosed with osteoporosis.
Oh, okay. Can you guys see my screen? The posture 101. Okay.
Yes.
Okay, cool. Okay, so I have a spine here. And especially with the holidays coming up, with traveling, like sitting posture in your car is really important. Okay. Oopsies. There we go. Okay, so my name is Cassie Chonko. I'm a doctor of physical therapy. I work at Body Balance off of Loman's Crossing, and I usually see a lot of individuals for spine conditions, so like neck pain, back pain, rhomboid pain. And posture definitely is a big thing just because a lot of us sit and live in sitting, so we want to make sure that we have a good position just to optimally treat our body. So I'll first get talking about the spine and just kind of the different parts of it. It can be complex, but that's for me to figure out. But the spine is made up of the vertebrae, which are these bones right here, these blocks in your spine. We also have the discs that are in between each vertebrae. The spinal cord resides in the center of the spine, and then these little yellow things coming out the side are the nerves. And then what's not pictured on this model are muscles. So we have a bunch of muscles along the back of the spine and around your front, and then ligaments that help support. But I like to, just as the title says, or the slide says, that the spine is the body's support beam. So just like when you're building a house, you want the weight to go through the support beams, not the drywall. So when we're thinking about posture, we want to almost think about lining up all of these vertebrae as if they're a stack of blocks, so that we can just let gravity hold your spine and you don't have to work for good posture. So what we have in the spine, it's good to have curves, definitely, just as, who was either Michelle or Anne, I think Michelle, you said that you don't want to be at a 90-degree angle. So curves are good. We have a little bit of a curve in the cervical spine, and then the thoracic spine should curve this way, but not all the way. And then the lumbar spine will curve in, and then the pelvis will go this way. And that is advantageous to have just because it helps with shock absorption and flexibility. So if we just had a straight spine, it's not going to allow for shock attenuation, if that makes sense. So like the curves in your spine are good. However, when we start to get into some posture abnormalities, you can see here how on this B diagram, if you have increased thoracic kyphosis or even a flat back here, then the forces start to get distributed unequally. So that's kind of what my job is to do, is to individually assess the spine and see where stresses are going where they shouldn't be, or where we can distribute loads to make everything rest better. And if you guys have questions, you can peep in. And this is basically the same thing that I just said. So 4 curves in this, there's the cervical curve, thoracic curve, lumbar, and then the sacrum. And we want those curves, and what good posture is trying to maintain that and stacking everything up so that the weight of your head just rests through your spine. And that also has to do, and with osteoporosis. A lot of times, older women have, or even just postmenopausal women are more susceptible to osteoporosis, and especially through your thoracic spine, so your mid-back. If you have, if the bones aren't as strong, then that can, and you have poor posture, that can cause a fracture. So it's really important to be aware of your spine health and making sure that you're keeping all of the forces equal through your body. So, and I'm kind of beating a dead horse, but with good alignment and a good foundation, that makes our muscles work better and make sure that we don't get fractures. Also, proper breathing, especially with COVID or even just the flu season. If you're all slumped over, it's hard to take a deep breath and kind of cough things out. Whereas if you're upright, then that allows your diaphragm to work better and all of the muscles are working as they should. So, going back to what I first explained, that the spine is essentially a stack of blocks. When we're building little kid building blocks, we want our bottom block to be level so that all of the blocks can stack up evenly. If your bottom block is tilted one way or the other, or tilted one way or the other, kind of like the Leaning Tower of Pisa, everything is just gonna topple over. So when I'm looking at and teaching posture, we wanna make sure that the foundation is level. And the foundation of your spine is your pelvis. And I like to say that they're your bony butt bones. So you know if little kids sit on you and they have really bony butt bones, mine used to be bony, they're not anymore. But that's the bottom of your spine, so that's what we're going to be working with to find a good posture. And on this model, we can see, so here are your hip or your leg bones, and then this spot right here, these are your sit bones. So what I'm going to have us do is find those bony butt bones, and that's how we're going to find our good posture. So Anna and Michelle, if you can scoot to the edge of your chair, and then take your hands, I'll move this back a little bit, and kind of sit on your hands. And my feet are flat, and I'm kind of sitting at the edge of my chair. So pooch your belly forward to tip your pelvis forward, and then slump backwards. So you should feel your sit bones rolling along your fingers. So we're just going back and forth. As I come forward, I'll feel myself coming onto my sit bones. And then as I come backwards, I don't feel my sit bones as much anymore, and it's more just like tissue. Do you guys feel that? Yeah? Anne, how are you doing?
Yes.
Yeah? Good. So the optimal spot is finding where your sit bones are the boniest and the heaviest. And going back to what I said, how the bones are your support beams. Whenever you're building a house, you want the weight to go through the beams. Your bones are your inner support beams. So we want to keep the weight through your bony butt bones. So what good posture is, it's not necessarily about sticking up and out your chest and holding everything, but it's trying to find a level foundation, or making your foundation level, and then letting everything else stack up so that the weight of your head can just rest. Because what happens is, if we're trying to hold good posture, we eventually get tired, and then we slump down. So if we can set up our pelvis to the right spot, then everything else can just kind of fall into place. Does that make sense? Yeah. And then especially with driving, what happens is the car seats are kind of slanted back so that then dumps or rotates your pelvis. I realize that black pants on this black seat is not very convenient, but when we sit in the car, then we end up being in this schlumpy position where we're not on our sit bones and we're more on our bum. And that's not only not efficient by putting the weight through your sit bones, but then also that's stretching out your back, where we know that it likes to have this little bit of a curve. If we go back to this picture here, we want a little bit of a curve in our lumbar spine. So when we're sitting in the car and everything is kind of dumped back this way, then that starts to put the spine or our low back in a position that we're not used to. And then even furthermore, as we start to slump back, then everything else starts to topple forward, and then your head falls forward, and everything gets tense, which now transitions us into our neck. So everyone's head weighs about 10 to 12 pounds, depending on how smart you are. But for every inch forward your head lies, so if this is normal, and what normal should be is your ear kind of lining up with your shoulder. And you can kind of see that in the picture. But for every inch forward your head goes, that adds an extra 10 pounds to your head. So if your head is like 3 inches forward here, then you're holding a 40-pound head on your shoulders. And then that's where you start to get a lot of tension in through these muscles along the back of your neck, because they're trying to hold up a head that they're not meant to hold 40 pounds. So I'll give a stretch towards the end to kind of help reposition that. But again, going back to the bottom block of your pelvis, or the bottom block of your spine being your pelvis, if everything is rotated back and then everything starts to slump forward, then that's when your head starts to fall forward too. And if you look at anyone in traffic sitting at a stoplight, a lot of people are sitting like this, which is okay. I mean, I don't do this, or I do this for a living, and I don't have perfect posture all the time. But if you continue to live in this position, then that's when everything just starts to get cranky, and it's kind of like the straw that broke the camel's back. So, not that your back can be broken. Does anyone have questions so far? Or do you guys ever have any tension in through your necks? Yeah? Yep. Me too. So, but in reality, we're in different positions all the time, kind of with what I was just saying. We're looking underneath the bed, or carrying something. Our posture doesn't have to be perfect all the time, but it is good to be aware of how your body moves, and at least getting it started in a neutral position and then strengthening so that your body can be resilient to handle these tougher postures. But I do recognize that not everyone is going to be upright all the time. And now, something that I like to give almost, it depends on my people, or it depends on the situation, but lying on your stomach, I think, is a great exercise, or just even a good position. I like to say that the best posture is your next posture. So even if you were to be sitting upright in our bony butt bones, but if you're doing that for several hours on end, you're still going to be loading through the same structures. So changing your position, so instead of sitting in a 90-degree angle where everything is kind of curved, lying on your stomach to stretch out the front part of your body, I think is a good option to change up your positions during the day. So even just lying on your stomach on the couch or on your bed or on the floor is good to move your body differently. And then a chin tuck is an exercise that I brought up earlier. So to get out of that forward head position, taking your hand, and you can kind of use it as a guide, bring your neck back, straight back, to feel a stretch along the back of your neck. Yep. There we go. Yes, Morgan. Yes, Michelle. Yeah, and it should be just a gentle stretch. Think about also not, we don't want to tuck our head down this way, or we also don't want to go up this way, but straight back. So think about if someone was pulling your ears back, you go back. And we used to, we still wear masks in the clinic, and luckily, when I wear a mask that covers the double chin, so. But that's okay.
The prone line one?
Mm-hmm.
Is that one, the picture shows that he's on his elbows. Is it just as good to do it
As long as it's definitely starting completely flat, or even putting a pillow underneath your stomach if it's too much, but progressing to up on your elbows, as long as it doesn't get like crampy or ginchy, or if you don't have any, ginchy is a made-up word. Ginchy is like compressed. So yes, even just lying on your stomach. Like during my lunchtime, sometimes I will lie on the ground. But just giving your body different positions and postures is what is ultimately best for your body. Just moving around. I say all the time that motion is lotion. So,
Great, thank you.
yeah. And then that last one that I have is a pec stretch. You can either do that in a corner, like the picture shows, or in a doorway. And you don't need to, or what I would not like, try to keep your arms in line with your body. You don't need to shove your chest forward. I think that that's a little bit too aggressive. So trying to feel a gentle stretch along your pecs, nothing too intense. I do think that we all have, or there's this stigma of no pain, no gain. And especially with stretching, I don't agree with that, just because stretching, we're trying to make our body more supple and more flexible. So if we are stretching to the point, and this is the same thing with the prone lying and the chin tuck, if you're stretching to the point where your body's saying that it doesn't like it, it's going to start tensing up and trying to fight you moving into that position. So all of these should be comfortable, that you should just feel a gentle stretch. But nothing, like I said, I don't do no pain, no gain. But just a very light stretch so that it's comfortable and you can breathe and that your body then can adapt to it. Because that's ultimately what we're trying to do, is that we're trying to get your body to move into those positions comfortably. And here's my little recap. So, bony butt bones are the base of the spine. And then this is, I'll get to the Queen's Guard in a second. So, sitting on your bony butt bones, on Wednesday, what time is it at, Haley? 11. At Wednesday at 11 o'clock, I'm opening up you guys to come into the clinic, and I can kind of work on, or if you have questions about the position or with what we're doing with your posture, you can come in to Body Balance at 11, and I have my schedule blocked off. I also would like to, or if you would like for me to help you sitting in your car, like adjusting your car seat, so that you're not super schlumpy. But bony butt bones are the ideal position to be sitting in. And then your next posture is your best posture. So the Queen's Guards, they have perfect posture all the time. Do you think that they have pain? I feel like they do. Even though they have good posture, they're standing there for, I don't know how long their shift is, but for a long time. So even though that they have good posture, they're there for a long time. So the best posture is your next posture. So even if you're working at the computer for a long time and you have your good sit bones, try to maybe just stand up, shift your weight around, and then you can sit back down. But just moving throughout the day is what is best for your body. And then so to do that, you can either sit up or sit on a ball, an exercise ball that kind of makes you move around a little bit, or like I just said, set a timer to stand up every 30 minutes. And then 2 more things is that whenever you're on your laptop, depending on the height of your screen, I would like, ideally, the bottom of your screen to be in line with your eyes. So I know that seems really high, but the lower our computers are, if my computer was actually, so as my laptop is in my lap, what's going to happen is I'm going to start to come towards it to look at my screen. If I propped up my laptop or my phone or tablet or Kindle or whatever up on some pillows, if I'm just sitting at the couch or at your desk, that then prevents you to have to bring your head to the screen. So trying to elevate your computer screen so that everything is in line is a good way to set yourself up for success. Oh, yes, do you have a question?
I don't have a question, Cassie. I just wanted to say that my son, about 2 months ago, sent me like an elevated device for my computer.
Great.
They decided to permanently work at home, so he had one at home and he had one at the office, which they sent home with him. He sent it to me, and it's wonderful.
Yeah, it's helped, yeah.
He told me that they are available from Amazon and relatively, he sent me this one, but he said that they're available from Amazon. And he also said that if you tell people, I said, oh, I know a lot of my old lady friends that will enjoy this. And he said, well, make sure you tell them not the script and get a really good one. This one is metal. And it's raised the whole screen up, and
You can tell a difference.
too much, but it's been such a
Yeah.
difference.
Yep, definitely. And then something else is that if you have a laptop, I would recommend getting a wireless keyboard so that if your screen is super high, that you don't have to also keep your hands up, but you can get a wireless keyboard or even just a regular keyboard and plug it in and keep it just at the normal desk height so that your head is in a good position looking at your screen and then your hands can be down a little bit lower.
He sent me this too.
Oh, good. Oh, I can't. Okay, nice. Perfect. Good. What a good son. Yes, good. So here's my little, everyone is different. Not one size fits all. It doesn't work for everybody. So all of these things are generally helpful, but I always recommend that if you have continued pain or like issues, like if I hear all the time people sometimes have pain in between their shoulder blades, or if you get headaches or low back pain and it's kind of consistent, it's much better or it's much easier to correct when you first have it as opposed to waiting longer and letting other things kind of build up. So when to know if you need help is that, like I said, if something continues to keep on coming. And I'm really big on making sure that you get hands-on treatment just to make sure that either if you need manual correction, like joint stretches or cueing, to correct what you have instead of just trying to figure it out on your own. And then making sure that we're strengthening so that your body is more resilient to all of these forces and that you can stay strong for forever, for as long as until our expiration date hits. So does anyone, Anne or Michelle, have any questions? No, you're good. Anne, anything?
Information, thank you.
Yeah, good. And as I said, if you guys want to come on Wednesday at 11, I'll be reviewing this again. I have my schedule blocked off, but with these, we used to do in-person workshops at the library. I don't know when we're starting to go back to those, but I really do miss being able to kind of correct people or kind of cue, just as I said, like hands-on things. So the invitation is welcome for you guys to come in at 11 on Wednesday at Body Balance. But if you guys don't have any questions, then I will head out.
Well, I'm really appreciative, Cassie. Thank you so much.
Yeah, you're welcome. Thanks for coming.
I don't necessarily need the whole presentation, but is it screen 10? Is there a way for you to send us screen 10?
Oh, you mean slide 10? Yeah, if you...
Yes, that's fine.
Yeah, oh, okay. Yeah. If you,
Oh, wait a minute. I can take a screenshot.
Yeah,
I can
sure.
take a screenshot.
Sure.
Or Cassie, if you want to email me the presentation, I can text it. Not want to send out the email afterwards.
Sure. I can do that too. I just have to, but if you guys want to screenshot. Yeah, Morgan will send out a final email. Okay, are we good? Nice.
Very good. Thank you so much.
You're welcome. I hope to see you guys soon.
Thank you.
Bye.
Bye.
Have a good day.